Okay. Hi, my name is Derry, a medical doctor and the head of translational medicine in a private cardiological medical center. Today, I'm going to talk about the side effects of PPIs like omeprazole, Prilosec, Losec. What I'm not going to talk about is how to take it, as there are already plenty of videos on that already. I will simply add that it's best individualized at the lowest dosage for the shortest time and do not stop taking immediately, but at either half the dose or on alternate days. So while these medications are effective in reducing stomach acid and are often used to manage acid reflux and other gastrointestinal issues, their long-term use actually carries significant risks that are often overlooked, which is concerning for such a commonly used drug. The first major concern I'm going to talk about is that PPIs interfere with vitamin D, calcium, and magnesium absorption, leading to an increased risk of fractures commonly in the hip and back, anemia, arrhythmias, muscle cramps, and general muscle related issues, sleep, and other neurological issues. This is because stomach acid is necessary to dissolve these vitamins and minerals. And when we reduce this stomach acid, this compromises these processes. I usually see an uptick in the number of related patients during the winter season, perhaps because of binge drinking and eating, or perhaps because of the holidays or seasonal affective disorder, where depression is a common symptom. This is also exacerbated by reduced exposure to the sun and therefore less vitamin D. Normally, you would think that eating more would correct any deficit, right? But all that eating and drinking would actually cause reflux or discomfort, and the first thing people would do would be to take PPIs, which would lower the acid levels to the point where the body is unable to absorb these vitamins and the cycle repeats. This can also be compounded by certain diets, as plants contain anti-nutrients as well as phytotoxins. So people on such diets should actually require more considerations. PPIs can also weaken the body's immune defenses. Stomach acid helps neutralize bacteria present in food, and when it loses this acidity, harmful bacteria such as Brucella, which can affect the heart and testicles, H. pylori, which is extremely common, or other gastroenteritis causing pathogens can thrive. Or this can also extend recovery times and even potentially cause changes to your gut microbiota, increasing the risk of C. diff and SIBO, which is an overgrowth of bacteria in your small intestines, which is connected to your stomach. Some people might also be hypersensitive to PPIs, which can damage their kidneys and bladder. Another often overlooked issue is how rebound acid secretion happens. When PPIs are taken, the body compensates by increasing the number of enterochromatin-like cells or ECL cells that stimulate acid production. These ECL cells are active in the first phase of gastric acid production, which can unfortunately be triggered by simply the anticipation of food, leading to discomfort at seemingly random times. The new ECL cells take about a week on average to form, which means you're unlikely to feel the side effects of the body's compensation mechanism until much later. But when it happens, it can last for several weeks. And this also increases the risk of diffuse gastric carcinomas, so people with a family history should be more careful. This is also why patients often struggle when trying to discontinue PPIs, as they are hit with prolonged discomfort and want to take immediate steps to alleviate it, which is a completely normal reaction. Next is that reflux, which is one of the reasons why so many people are on PPIs, can also be caused by low stomach acid. There are two types of reflux: GRD, gastroesophageal, and LPR, laryngopharyngeal reflux. And both can be caused if the stomach sphincter, which acts like a valve that closes so that the stomach acid will stay in the stomach where it's supposed to be. This sphincter will not close if stomach pH is not acidic enough, which means that PPIs have gone from being a solution into the problem you're first taken to solve. Atrophic gastritis is also another condition associated with long-term PPI use. This can lead to mucosal atrophy, low hydrochloric acid, and also deficiencies like in B12, folate, and iron. It can also cause autoimmune problems and cognitive decline. While on the topic of cognitive declines, there are a couple of studies that actually show a positive association between PPI use and dementia, but this might also be because that the people that require PPIs have a higher risk of dementia. For most parts, our body is able to compensate with manageable symptoms until it can't. And we are also stressing a system that's already under constant stress and is declining year after year because the way our body is able to process many of these such medications, including PPIs, changes with age, with Asians and elderly being affected the most due to alterations in the liver enzyme CYP450. This also means as we age, we are unable to process these medications as well, and this also affects other common medications like aspirin. So both are competing for an enzyme that's actually getting weaker and weaker every year, increasing the risk of cardiological and neurological events, possibly leading to studies that suggest a positive association between GRD, GERD, and acute myocardial infarction. Our bodies also get more acidic as we age, making it more difficult to keep everything in homeostasis balance. So with all these side effects, why do we still recommend PPIs? Is because the risk currently outweighs the benefits. Reflux can increase the risk of esophageal cancer, negatively impact your life with esophageal inflammation, coughing, constantly having to clear your throat. There are alternative treatments such as H2 receptor blockers that reduces the amount of histamine that the excess ECL cells create, or antacids like zinc carnosine. However, these medications also come with their own risks. For example, we now know that antihistamines is linked to dementia, and we might also observe endocrine side effects like a lower libido as well as other potential drug interactions. As for low stomach acid, we have betadine hydrochloride and now histidine. When I was in translational medicine in oncology, where we push past the limits to find solutions when the normal guidelines have failed, one of the factors we are always concerned about is tolerance, which is the term I will now use. Treatment has to be personalized for your tolerance and quality of life. There isn't a one-size-fits-all, especially when tolerance to the drug changes over time for each individual. Thank you for your time. Thank you for listening. This is Dr. Derry signing out.